We all know that it is a really bad day for both the doctor and the patient when someone comes in with a broken abutment screw or a failing implant that needs to be removed. The Salvin Implant Rescue Kit is designed to remove broken abutment screws without damaging the body of the implant, and to remove a failed implant while preserving adjacent bone. Here's how you use it to remove broken abutment screws. Place the guide on the implant using the stabilizing handle. Insert the drill into the implant handpiece. Set your motor to reverse at 1,000 to 1,250 RPM and 50 to 70 Newton centimeters of torque. Drill in reverse using an up and down motion to prepare a 1 to 2 millimeter deep dimple into the top of the broken screw. Now it's important to use external irrigation to minimize heat. Use suction to remove metal shavings, then insert the tap into the implant handpiece. Set your motor to reverse at 70 to 80 RPM and 50 to 70 Newton centimeters of torque. Then insert the tap into the 1 to 2 millimeter dimple in the top of the broken screw and use the tap in reverse to remove it. The broken screw is then removed. The kit includes centering guides that fit most major implant systems. Here's how you use it to remove failed implants. Insert the fixture remover screw into the hand adapter. Then insert the fixture remover screw counterclockwise into the implant. Using the wrench, turn it counterclockwise until the implant becomes mobile. Remove the failed implant. For difficult cases, use the matching trephine to cut away bone approximately 1/2 the length of the implant. Then use the fixture remover to remove the failed implant. The Salvin Implant Rescue Kit will make a potentially really bad day go much easier for you and your patient. Call us before you need the kit, and we'll take great care of you.